many of the things that he has learned over his lifetime of serving our community. I had the pleasure of working with him during the pandemic and seeing him keep his cool, seeing him give updates to the commissioners and be part of the community and be part of the lead in helping us navigate the COVID world. And I just want to say, Rob, thank you first and foremost for your service to our community. You were welcoming when I moved into this community. You always took my call, which I can't say that about everyone, but Rob always took my call and always helped us here at United Way, and I appreciate that. And with that, I get to announce Rachel Terlizzi on my team, who I stole from Rob, and I was very honest with Rob when I was going after Rachel. I was like, Rob, I'm taking her, so I'm sorry, but she's coming over to my team. So Rachel, you get to introduce Rob one last time as a CEO of Cleveland Clinic Martin Health. So go ahead, Rachel.
I am so pleased to be able to do so. Rob Lord serves as the president of Cleveland Clinic Martin Health. Prior to that, he was the president and chief executive officer of Martin Health System. Prior to that, he served as Martin Health Senior Vice President and Chief Operating Officer. Mr. Lord oversaw construction and development of Tradition Hospital, responsible for medical staff development, governmental and business community relations, clinical research program development, hospital startup, and operations. Rob joined Martin Health System in 1998 as the Vice President, Chief Legal Officer. Prior to that, he was a partner in the Crary Buchanan Law Firm. Rob is board certified by the Florida Bar in Health Law. He is also a fellow in the American College of Healthcare Executives, board certified as a healthcare executive. Mr. Lord received his Juris Doctorate degree from Stetson University College of Law in 1983. In 1980, Mr. Lord received a Bachelor of Science degree from Florida State University, go Noles, with majors in government and communications. And with that, I would like to turn it over to Rob.
Thank you, Rachel. I am incredibly proud to be introduced by you. And I'm very proud of Rachel. She's, you know, when you get to be my age, you get to sit here and talk about somebody like Rachel. Well, I watched her grow up. And but she's a great leader and a great asset to our community. Good afternoon, everybody. As Rachel said, I'm Rob Lord. I'm honored to be here with you today. I'd be remiss if I did not say that I'm a proud supporter of the United Way. I've been doing that for decades. Started, I think, been doing it continuously since 1986 locally, when I started with the Crary firm. And for the past several years, as Rachel said, I've served as the president of Cleveland Clinic Martin Health, or before that, Martin Health System. Now, as many of you also know, I've been a part of not only the organization, but the community for many other years. My family moved here in 1969. So I'm a product of Parker Elementary School, Stewart Junior High School. It was not a middle school yet. Then I went to Murray ninth grade. We sent every ninth grader in the county to one school. That was a crazy idea. Why in the world would you send every 14-year-old in the county to one location and have them all feel like they were the big person on campus? We did it here. And then I went to Martin County High School, graduated in the year of our bicentennial, 1976, or as I like to say here more recently when I do orientation and ask if anybody's from a local high school, I graduated Martin County High School class of before you were born. And then I went away as I did spend a decade or close to it outside of our community when I went to college and law school. And then I went to Miami for a couple of years right out of law school because I was young and single and thought that's what I wanted. And it took me about 2 years to understand that, or to learn that that was not for me, that I needed to get back home. And the Crary firm was looking for a trial lawyer. That's what I was. And I came back and became, among other things, a lawyer for Martin Memorial Hospital. And that was an incredible privilege, but I had plenty of other clients. But through the years, the type of work I did for the hospital continued to grow and expand. And I taught myself health law because I was interested in it. And that became a different career path. One of the first things I'd say in giving leadership advice or career advice to somebody is don't put yourself in a box. If I had, I'd still be trying cases. And I love trying cases. I love trial lawyers. That people talk ugly about lawyers need to understand that virtually every right that any of us have, we have because some lawyer somewhere fought for it in a courtroom. And it was a noble career, but then I had a chance to join the hospital. Dick Harmon came and said he thought he could put me on the payroll for less than he was paying me by the hour. And it turned out that was true. And I joined the hospital in 1998 as its first chief legal officer. And then I became, as Rachel went through, I actually had the longest title in the history of the organization. I should throw this in there. I'm very proud of this. My title at one point was Senior Vice President, Chief Legal Officer, System Facility Management, Tradition Medical Center Campus Leader. That was the title. I had that on a business card. The font got so small that you couldn't read what my title was. And one of our board members was trying to introduce me to some of his friends, and he could not get that long title out. And he said, oh, heck, he's our chief operating officer. And a couple of days later, I went to him and to Mark Robitaille, who was my boss at the time, the president here and a dear friend. And I said, well, if you're going to call me that, you might as well give me the title. And I became the chief operating officer a little while after that. And then when Mark retired, I was honored that the board selected me to become president and CEO. And that was a remarkable opportunity to lead a critically important mission-driven organization committed to improving the quality of life in a community that I love and where I plan to spend the rest of my life. People ask me what I'm going to do when I retire. I'm going to move to beautiful Palm City, Florida. You may have heard of it. Got a little spot on the South Fork of the St. Lucie River, and all the trout and snook that live out behind my house need to live in fear. But I will release them if they get caught. But I'm very fortunate to be at the helm of an organization that has such a noble mission, and that I every morning when I get out of bed, I can feel like I have an opportunity to do something that'll contribute to improving the quality of life. And obviously, we all want to earn a good living, but I think that feeling like you do something that's important for me has enriched my life tremendously. And to be able to work in an organization that cares for just about everybody that I love, all the people that I went to school with, all my family and friends, the vast majority of those people live here and they turn to this organization for care. So I've truly led a blessed personal and professional life, and know that I consider myself very, very fortunate. And I don't know what I did to deserve this, but I'm grateful. A little bit of local history on our healthcare system. A little over 80 years ago, the Barstow family and the Reed family gave some land on the bank of the St. Lucie River to the community, basically to build a hospital. And in 1939, that hospital opened up on the banks of the St. Lucie. Over the last 50 years, I personally have watched amazing growth. I remember as a child what this hospital was and what it wasn't. We'd come from a rather advanced community in Nashville, Tennessee, and moved here, and a lot of things weren't available here that were available up there. But since that time, 8 times, our hospital was named one of the top 100 hospitals in the United States. That put us in a category, we were one of the top 20 large community hospitals in the United States. I was very, very proud of that. I am very proud of that. We were so good, in fact, that the Cleveland Clinic came knocking and asked if we were interested in joining the Cleveland Clinic. Now, I'll talk a little bit about the clinic. If I were to try, if you ask me what are the best comprehensive healthcare organizations in the world, my personal answer would be, and this is before the merger, Mayo Clinic and Cleveland Clinic. Now, if you wanted cancer care, I'd throw in MD Anderson and Sloan Kettering, and we can talk about certain things. But if you said somebody that does everything and does it really, really well, well, those are the 2 best. And there's something interesting about that most people don't know. Those organizations both began about 100 years ago. Doctors came back from World War I, some to Rochester in Minnesota and some to Cleveland, Ohio, unbeknownst to each other. This was not something done in concert, but they had the same exact reaction. While they're in Europe, under horrific circumstances. We were going through this COVID thing. I went back in 1918, 1919, young people, the Spanish flu or the flu pandemic of 1918, 1919 affected young people more than older people. Older people were pretty much spared. But young people died in mass numbers. Soldiers died in mass numbers. And meanwhile, there's horrific battlefield injuries, and these physicians, from what I've read, were under these incredibly challenging circumstances, and they worked as a team, and they did remarkable work as a team. And then they came back home after the war, and they were disenchanted because it was an individual activity in the civilian world. Doctors didn't necessarily talk to each other, and they didn't function as a team, and it was hierarchical, and nurses may not feel as respected by doctors, et cetera, et cetera, et cetera. That was the way healthcare was the training worked for doctors and nurses. And they said there is a better way to do this. We have seen this. We will create it on our own. And thus was born the Cleveland Clinic and the Mayo Clinic. And 100 years later, in my opinion, they're the two best healthcare organizations in the world, and maybe they're on to something. Maybe every healthcare system should look at what we do as a team sport. I will tell you that was a drive that I had in my role to try and improve that evidence-based medicine and to function as a team and for everyone to feel valued. And so we joined the Cleveland Clinic in 2019 and became part of a global healthcare organization that's been delivering world-class healthcare for decades. And I'm incredibly proud of that. We are now a thriving healthcare system. We have 3 hospitals, one of which is Tradition Hospital up in Port St. Lucie, and that's a newly formed campus, relatively so. And I had the privilege of having administrative responsibility for that while I was chief operating officer. Actually, when I was that long title, Tradition Medical Center campus leader, was that part of that. And so I got to oversee the construction of that, and very proud of that hospital. I did not build a hospital. In fact, we had doctors and nurses design that hospital. My most important role was to make sure that my fellow executives did not stick their finger in the pie and mess up the design that was made by doctors and nurses. And I'm very proud of the way that hospital functions. It functions well for the providers and for the patients. So it's worked well. Before that, as the chief legal officer, I was responsible to oversee the legal fight that led to the construction of that hospital, St. Lucie Medical Center and Longwood Regional Medical Center. Didn't feel like a hospital needed to be built there. We had about a 15-year legal fight. Excuse me, need to wet the whistle. So I was very proud of that. And then I got to work on the acquisition of the VGTI building that is now the Florida, we call it FRIC. It's an unfortunate acronym, I'm afraid, the Florida Research and Innovation Center. But they're doing amazing research right now on things like COVID. We have what's called a BSL-3 lab where they can work with the most deadly live viruses. It's a remarkable building, remarkable research is going on there. And I think that in the years to come, the community's can be very, very proud about what happens there. That never would have happened without the Cleveland Clinic. And it was an honor to have also overseen the merger with the clinic and to have negotiated that deal. Those accomplishments, if someone asks me what are the lasting accomplishments of your career, I would say that Tradition Hospital, what the Florida Research and Innovation Center is going to become, and the merger with the Cleveland Clinic and the long-term impact on our community are probably going to be the longest lasting, most impactful things that I was involved in. But I don't think any of those things would have been accomplished at first if we hadn't been guided by a noble mission and a set of values. And to our subject today about leadership, I'd like to talk a little bit about that, particularly the values. The values are things I hold very dear, not just as a leader, but as a person. They're where I try to focus my behavior, how I try to exemplify the values. The values, the organizational values are first, quality and safety. And I would say in your work, anything you do, quality, it comes through, and people appreciate quality. And if you don't, it will come through as well. And attention to detail and those sorts of things. And if you're in a business where safety is an issue, then you need to pay attention to safety. For us, safety, those things go hand in hand. You can't have quality without safety in healthcare, but that's an important value. Empathy to me is an underappreciated value. You can accomplish so much more as a leader if you are empathetic, and and I'll talk a little bit more about that in a bit. Teamwork is a value that is, I think, critical for us all. Integrity. If you don't have integrity, you don't have anything else with your workforce, with people you lead. If they don't feel that you have that, you can't lead, in my opinion. Inclusion. And I think this is a more important value today than it's ever been. We need to break down barriers and silos. It's time for us to grow up as a species, if you will. And I'll talk a little bit about that. And then innovation, creativity and innovation, change. We have to embrace change, and we have to look for ways to become in business. If you're going to be a leader, you need to innovate. You need to find ways to create efficiency, to improve quality, to improve satisfaction. But most of the time for me, to make those improvements, sometimes it's going back to basics, and sometimes it's coming up with something new. So I value that. If I were to focus on those, just a few of these, first I'd like to talk about empathy. I think it's really important to try and understand what somebody else is going through, and to express empathy. And if you're going to be in leadership, you're going to have to make difficult decisions. You'll impact people in ways. I only half joking have said that as my career advanced, it would have helped me a good bit if I'd been a little bit more of a sociopath. If I had not cared about what happened to the people that work for me, if I had not had empathy. But at the same time, I think that my people know that if I have to make one of those decisions, that I agonized over it, that I didn't take it lightly. And that makes people more accepting of it. If there's bad news, you have to deliver. But if you don't have that, again, it's going to be hard to relate to people. Now, when I'm thinking about empathy in my line of business, a lot of time that's a patient or their family member, quite often a family member of a patient. And I frequently deal with frustration, and I understand it. We're far from perfect. We are trying to constantly get better, but we know we have room to improve. But that's too often in healthcare. I think we focus on that. We don't focus on empathy for our caregivers, for the people that provide the care, for the people that we work with. I think the COVID situation is an incredible example. I mean, the people that work in this organization have done a remarkable job under the most trying of circumstances. And I've witnessed some of my people being attacked for suggesting that people should wear masks or engage in, and I have a zero tolerance for that. If you want to draw fire from me, attack one of my people. They know I'll rise to that. I did get in trouble for that, by the way. Maybe I shouldn't share this, but I will. Someone attacked one of my caregivers on Facebook. She said she was in the grocery store wearing a mask with her children. Somebody came up and said she shouldn't do that. It was bad for the kids, and they had an ugly situation. And some people commented on that, and I jumped in the middle of it, and I gave a long lecture on the historic readiness of Americans to sacrifice for the public good, and what they did in World War II. And the sacrifices that were made with rationing and all kinds of things to support that effort. And then I concluded by saying that that I'm glad that people back in of that generation didn't have some of the concerns we have today, or we might be flying German or Japanese flags over the country. And I drew a lot of fire for that, folks. I got a call from Ohio saying, you might want to delete that post, Rob. But anyway, empathy, if you focus on empathy and you express it, you can alleviate suffering. What greater, if you want to have a good day, alleviate somebody's suffering and go home and think about what you did. And better yet, if you can then create some joy, you've had a great day. You've had a great day. Inclusion, I talked about a little bit, and I do want to talk about that. We have to be intentional in creating an environment where everyone feels like they belong and they are valued and respected. And when I thought about how to illustrate this, I want to talk about a gentleman named John Scott for a couple of minutes. Mr. Scott worked at our hospital. In 1939, he started in Hobe Sound walking on foot. And John got to Stewart and walked by the new hospital that I just talked about a while ago. And he told me that the superintendent of the hospital was out there trying to water some plants, and it was hot in the middle of summertime. And he walked up to him and said, "You look like you need a gardener." And 70 years later, Mr. Scott was still working here. He had done about every job you could do. He was a remarkable man and a dear friend. And one of the greatest honors of my life was when I was asked to speak at the celebration of his life after he had passed. He's just a remarkable community leader. But he told me this story about, and I wish I could tell you the expression on his face as he told me. Right after World War II, there were two young men that were in an accident in Western Martin County on a truck. They were brought in on a truck. I think it was a tractor rollover, and they had broken bones, and they brought them into the hospital and tried to fix them up. And the young men wanted to stay together in a room. All we had were semi-private rooms at the time. And but the problem was one of them was black and one of them was white. And this hospital was segregated at that time. This was true throughout the South. And they weren't allowed to stay together. And the young white man said, well, if he couldn't stay with his friend, he would cause a fuss, and he wanted to leave the hospital, and it got to be contentious. And the administrator of the hospital, the fellow that held the job equivalent to the job I have today, and the chair of the board met. And Mr. Scott, there was a rope that they could pull, the superintendent could pull from his office, that would pull a bell and cause a bell to ring that would summon Mr. Scott. But he told me through that pipe, he could hear what happened in the superintendent's office. And he heard these men arguing about what could happen, but they came to the conclusion they would allow them to stay together as long as they didn't go all over town and tell everybody. And so they did. But when John told me that story, what struck me was when he told it, he was so proud of the decision that was made. And the way he told me was, he said, for that short period of time in that one room in the hospital, segregation ended. I can't think of a better example of the value of inclusion. What it means to a person to feel like they belong and that they're included and that they're equal. So in my work, I emphasize I'm on a first name basis with everybody. I don't care if you sweep a floor or you're a neurosurgeon. It doesn't matter. I'm Rob. And that has never cost me. I've never paid a price for that. I'm not saying everybody has to do that, but that's my way of relating. I can give you examples, I think, of where it's come in handy, where I found out things that I wouldn't have found out if I hadn't been on a first name basis. But I always think about John when I think about that, and he is an inspiration to me to this day, and he was a dear friend. I've talked a little about integrity. That's high moral principles and professional standards. A commitment to honesty, and my people need to believe that if they ask me a question, if I can't answer it, I'll tell them I can't answer that question. But if I do answer it, I'm going to be honest. And if they ask me to keep something in confidence, I'll keep it in confidence. I learned that as a lawyer. And you have to be that as a lawyer, but you mean everybody needs to be that. People have to be able to trust you. If you do those things, you'll have their respect, but you need to respect everybody. Doesn't matter who they are, where they're from. And then transparency, be as transparent as you can. And I put all of that under integrity. I think teamwork is again, another value that is dear to me. I have accomplished very few things in my career on my own. I've accomplished some remarkable things as a member of a great many teams. And all of those things that I listed as accomplishments in my career that will be lasting, none of them, not only did I not do them on my own, the cumulative effort of the others so far outweighed my minor contributions to those things. And I want people to know I know that. I've ridden on the shoulders of the people I work with to most of the success, all of the success that I've achieved. But team collaboration and teamwork are critical. That's how you get to the best of anything. For us, it's the best care. It's the best safety. It's the well-being of the people who work here, but it's a function of teamwork. This is not an individual sport. And I would respectfully submit to you that there's very few businesses where that's the case. So those are the values that I'd call out. And then I would like to go through a few things on how I've tried to honor these things over the years. First, I try to be curious, and you should be curious too. Be hungry to learn more, ask questions, take on more responsibility, challenges, volunteer. What was my secret to success? There was no secret. It was anytime something came up that I thought I could do, I'd raise my hand and say, I'd like to have a chance to try and do that. And I will tell you just my own view. I never asked for more money. Not once. Give me this responsibility. And then once I did the job, then I got paid more. But I can't help but wonder if I'd have been given those opportunities if I had said, if you'll pay me another $100 a week, I'll do that. But I was very fortunate that I had bosses that gave me a shot, and then I worked hard at it, and that allows you to grow in leadership. And the way I became chief operating officer was I went to Mark Robitaille at the beginning. I said, I'd like to have an opportunity to lead other areas. And they gave me environmental services and nutrition. And when I first had those areas, the people avoided me. There was a young lady that cleaned my office every night that I knew well. We were on a first name basis together, and we had been for several years. And so I asked her, what am I doing wrong? And she laughed and said, Rob, what happens after the vice president learns your name where I work, the next thing happens is you lose your job. I thought, well, that's terrible. I need to get to know him. So I walked into the cafeteria. It's a true story. If you walk into the hospital cafeteria, you will see us. I hate this. We sit in our tribes. There'll be nurses at this table, and there'll be doctors at this. You know, we divide up, and I'd like to see us mix more. I think that would be a good thing. But I walked over to the table with my tray that were all the people from environmental services. Other people will call them housekeepers, by the way. I do not. They are not housekeepers. They're environmental services professionals to prevent infections, are highly trained. They are not housekeepers. But I walked over to the table and asked if I could join them. There's a wonderful caregiver here, been here for many, many years, a lot longer than I have, Betty Darville. And Mrs. Darville was sitting at the table. She's very outspoken. I love her for it. She'll be honest with you. If you don't want to know what Betty thinks, don't ask her. And sometimes you won't have to ask her. But Betty, I walked over and asked if there was anything that I could help out with. And I had stifled conversation. I don't think I was that welcome at that point, but I knew they couldn't turn me down. Like I walked up and, may I join you? Or they're going to tell me no. They can't. I put them in an awful position. But we sat there, and sure enough, Miss Betty decided to tell me something was wrong. See, everybody else at the table was like, oh no. And here's what Betty told me. She said that sometimes patients had accidents, and the nursing is the patient care technicians, or the nurse assistants, are supposed to help the patient get cleaned up, and the environmental services professional gets the room clean. And she said, but this nurse assistant wanted Betty to clean the patient. And she said, I don't think I'm supposed to do that. I said, you're right. And I'll talk to the chief nursing officer. Many of you probably know Karen Ripper, and Karen was chief nursing officer at the time, still a dear, dear friend. But then Miss Betty said, and sometimes they have accidents and sometimes it doesn't smell good. Now I have a sick sense of humor, folks. So what I said to Miss Betty was, Betty, after I said, I'll address that. I'm going to talk to Karen Ripper about that. I do have a question for you, Betty, because you said sometimes it doesn't smell good. I want to know, sometimes does it smell good? And she looked at me and thought like I was just a fool. But then she realized I was just having fun because I said, Betty, I know some people who think theirs doesn't smell bad. But I personally have never come across any that doesn't. And she laughed and everybody laughed. And the next thing you know, we're telling jokes. And the next day I walked in the cafeteria and they motioned me over to the table. And from that point forward, we were still eating in the cafeteria. We haven't been since COVID, but we'd still be sitting together. But that was, a lot of that was drawn out of curiosity. And I wanted to learn more. And what I wanted to know was, this is another important point for leaders. I wanted to know who they were. I wanted to hear about their families and their children and their pets and what they like to do for fun. If we establish that and we get to know each other on that level, then it makes it easier to work through all of the other things. And what goes hand in glove with that as a behavior is listening. Leaders tend to be good talkers. But we need to appreciate the value of things that are unknown to us and acknowledge the things that are unknown to us. And to do that, you have to listen. And listening sounds straightforward, but it's one of the hardest things to do for a lot of us. Most leaders, especially new leaders, try to impress people. And we impress people by talking. I would again suggest to you that to a more seasoned leader, if I'm watching young leaders, I'm looking for the one that asks good questions and listens. The older I get, the more I realize how little I know. And maybe it's more important, I think, as a leader to know what you don't know than to know what you do know. And listening doesn't come naturally. I'm a talker. If you've ever gone through a psychological profile, I'm a talker doer. My daughter, Alexandra, is on this call. She's listening in today, and I bet she can vouch for this when I say I am not a good listener. I can't tell you how many times in her life and in other people's lives, especially as I was younger, where they'd get halfway through a sentence and I'd stop them right there and just I'm going to tell you what you need to do without listening. I've tried to develop my listening skills. I am still learning. There's still much room for improvement. I will say this too. I think a really important part of listening is to be humble and to ask for guidance and mentorship. Never be afraid to do that. I think another thing young leaders do a lot is they try to mask their weaknesses. Don't hide from them. Make them strengths. But the way you do that, when I first came to the hospital, I made a fool of myself, I think, pretty sure of it. Mark Cocarulo, another dear friend, is long retired, but Mark was the CFO and I said something and he just rolled his eyes in an executive team meeting. And I shut up right away. I realized I'd said something that wasn't right. But right after the meeting, I went to Mark, and instead of trying to hide from it, I went to him and said, Mark, I know I'd said something can you tell me what it was? Where did I go wrong? And then after that, would you help me get better at this? I know this healthcare finance is a weakness. I need to get better at it. And he actually set me up with Chuck Cleaver. Some of you may know Chuck. And Chuck became a bit of a mentor and helped me learn. And I helped, that turned into an area where I could demonstrate that I had a good bit of knowledge, but it was knowledge that I acquired from people that I was brave enough to turn to and admit that I didn't know and to seek their help. And most people will view that as a compliment and an honor, and they'll try and help you. And to that, I'll say, be who you are. That's another behavior I think that is just to thine own self be true is the line that comes to mind. That's taken from a Shakespeare play about a troubled prince named Hamlet, you may have heard of. And the context has changed over the years since the Elizabethan times, but the modern interpretations are really what I'm talking about. Be honest in your intentions and your ways. And always try to do the right thing. And I've learned over the years, instead of trying to solve problems and control situations, I've learned to first of all, surround yourself with a team. It's not, you don't have to solve everything. Surrounding yourself with great people is the solution. True leadership, you select people carefully that you work with. You surround yourself with people who know more than you do. Another mistake I've seen is people won't hire somebody because they're afraid they will threaten them for their job. I've hired a couple of lawyers that were better lawyers than I was to lead legal here. They both became leaders of that, but it never, I always received credit for that, and it always worked out well for me. You have to trust yourself and trust your intuition. And maybe the best way for me to get to this, what I'm trying to get to is a story. And I think it demonstrates empathy and listening and teamwork and curiosity and a lot of these things. There was a situation we had in the hospital where there was a man, I was rounding on the floor doing something. If you go to business school, you may hear of this acronym, MBWA, management by walking around. And I was just walking around. And I come by an unfortunate situation, an angry patient. He's got his cane in the room and he's threatening people with the cane because he was told he was going to be discharged from the hospital early afternoon. And now it's late afternoon and he's being told he's not going to be discharged from the hospital. And he's not going to be discharged from the hospital for a good reason. His health is not, he's not ready to go home. They need to extend his day. Some of the test results came back with that thing. And there's a doctor in the room that's standing talking to him, and they're having this conflict, and the doctor's frustrated and he's frustrated and the nurse is frustrated. And I stand outside in the hallway and I listen, and the doctor comes out so I made a couple of suggestions. One was you're standing over somebody that's a threatening position, get down to their level. That's also a bit of a metaphor. Get on the level with the people that you're working with. Express some empathy here. This is a man who was told something and we've disappointed him, and he has a right to be disappointed. But there's a reason we're keeping him, and it's for his own good, and we're trying to help him. But the first thing is to acknowledge he's right to feel frustrated. And I got pushback from that. The doctor told me it wouldn't make any difference if you're standing up high or down low, and I didn't think that was true. And so I said, just stand back for a second. Let me just try something. I walked in the room and the man was in there with his cane, and I got down on a knee right in front of him. He could have hit me with the cane. I was within striking distance. And I started out by saying, sir, I couldn't help but overhear this. I introduced myself as the president of the hospital. He wanted to see somebody important. I said, well, you got the president. And I am so sorry. We shouldn't have said that to you earlier in the day because it wasn't true. And we have caused you to be upset, and I apologize. And I am so sorry. But we're concerned about your health, and we really want you to get better. And it'd be terrible if we sent you home. And so again, I apologize, but I promise you we're doing this for you. But you have every right to be upset. And he calmed right down. And he said, well, you're right. They shouldn't have told me that. And I said, you're right. Yes, sir. And by the time I walked up out of the room, I'd given him my business card. We'd had a nice conversation, and he stayed to the next day. But some of that was just allowing trust your own judgment and be who you are. And it'll all work out. And that ties into, I also believe very much in the concept of servant leadership. We try to practice this here. I work for the people who work here. My job is to make it a better place to work. If it's not a good place to work, I'm not doing a good job. But again, I'll go back to surround yourself with smart people, empower them, never be afraid to hire smarter people. Some of you may have heard of a guy named Jack Welch. Mr. Welch was the president of GE. I've had the privilege of sitting between him and Toby Cosgrove, the past president of Cleveland Clinic, at a luncheon, and there was more wisdom around me than I'd ever had. But Mr. Welch said from the first person I ever hired, I didn't want to be the smartest person in the room. And that is wisdom. I'd say hire the best person, get good. Your job as a boss is to establish an objective and make sure you have everybody's aligned on that objection. Then you empower your people to accomplish that objective, and then do not micromanage them. That's another thing I see all the time. I'm not a fan of it. People won't feel rewarded in their job, and most of the time the problem gets solved better if you let people do it. Promote teamwork, and then get out of your team's way and watch them do great things. Give your praise publicly. Give your any corrective action should be done in private. And if you're criticized or the work is criticized, you always take the responsibility. As a senior leader, when I see a junior leader, when something goes wrong, when I see a junior leader say, it's not me, it's everybody else, that tells me one thing. But when I see somebody step up and said, I'll take responsibility for this and I'll fix it, most of the time when I see that happen, I look back and I go, you didn't really do, you don't own this problem. You didn't cause the whole problem. There's a lot of people ought to be taking responsibility. But when I have one person in the room that takes responsibility, most of the time over time, they get more and more and more responsibility, because I know that, that's incredibly important to them, and that they will work hard to be successful. I've never paid a price for taking that approach. I think that's really important for me to say. To the contrary, I think my career trajectory it was improved by the fact that board members and senior leaders that were above me at the time, when I took that approach, they appreciated it for what it was. I guess in closing, I will start going into I have an incredible honor. I not only got to announce my retirement, they're letting me participate in the selection of my replacements. And I say replacements, there's going to be a president for Martin North and South, and there'll be a president for Tradition. And in the Cleveland Clinic, the hospital presidents are doctors. Now, I'm a doctor, but I'm a doctor of law. That's the wrong kind of doctor. These will be medical doctors. Or doctors of osteopathy. Just for the record, I want everybody, if you ever meet one of my replacements, just point out to them that it took 2 doctors to replace 1 lawyer. Just like that. But with my 7 or so months I have remaining, I'm going to work to ensure that the new leaders are well suited for our community and our health system. And hopefully, we've interviewed several remarkable candidates. They will, I'm sure they'll be well equipped with skills that I do not have. And I'm excited to see what happens after I retire. But I remain committed to our caregivers, and will even after I retire. I understand the unique contribution that every individual makes to the organization. Everybody on this team is critical to it. There are no jobs that we have around here that aren't necessary. And I am incredibly blessed to have had this mission-driven professional life. And I'll always want our hospital system to be the best it can be for very selfish reasons. 20 years from now, I'm going to be that 80-something-year-old patient that's upstairs in this hospital getting frequent flyer miles, looking at some nurse saying, I used to be the president here. And my plan is for them to take great care of me as I move into the future. It's been an incredible honor, but I've talked too long, and I want to make sure we have some time to answer questions. So I'll stop right there. But I do thank you for the opportunity to share with you my thoughts. So Rachel, I'll turn it back to you to moderate Q&A.
I'm going to give that honor to Carol. Go ahead.
Carol, I'm sorry, Carol. I didn't mean to take that.
No, that's okay. I was like, hey, I wonder which one of us is going to do that, because this
No,
is how we roll.
my mistake, my mistake.
No, 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 no. I mean, between Rachel and I was like, I'll unmute. We'll see which one of us talks first. But Rob, thank you for sharing your illustrious career with us. I think it's amazing. I kept shaking my head because the qualities you described were things that, and my staff cannot listen because they'll be going, yeah, right. No, but are the things that I try to do myself. I think it's really important that you have empathy and all of the things, lead by example and all of those things. But if people have questions, if they want to raise their hand, and then I can call on you and unmute, you do that by hitting your reaction button so that I can see it and it'll pop up. But if people have questions that they'd like to ask Rob.
While we're waiting on this, I got to say there are some remarkable leaders on this call that I've known for years and years, people that I respect so much and admire, some of our local community leaders that they should be the ones doing the talking. I should be the one doing the listening. So.
Vicki, I see you unmuted, so I think you have a question or a comment.
Yes, no question, just comments. I was trying to beat Ed Campy to the punch here because I know he likes to talk. I just wanted to thank you, Rob, for your commitment to our community, for everything that you've brought to the table through your leadership at Cleveland, and even prior to that, when you were at Prairie Buchanan. And I know your family has been here in the community for many years, like you said, since '69. You went all through middle school, junior high school here. And my family were generational Floridians. We moved here in '67. So just a few years before your family did. And I remember your dad from coming into the Prairie Buchanan firm. It was Hyman and Crary at that time because I worked for Evans Crary. But you are such an example of humility and graciousness and commitment. And I just want to thank you for your service to this community.
Vicki, coming from you, that means the world to me. I just point out to everybody on this call, anybody in the community, I've shouted this from the rooftops a couple of times. There's all this talk around our country today about votes and vote counting, and we've had it through decades. And Vicki and her team have done this amazing job in Martin County.
Well,
they said something to me, and I go, yeah, I can't relate to that. I'm sorry. Where I come from, we have an incredible person that leads that effort. So Vicki, I'd say everything you just said about me, I'd say about you.
Well, I sat here and listened to you. I listened, and when you talked about teamwork, what we do here in the elections office, I cannot do by myself. It takes the team, just like you said. So thank you for setting the example.
Thank you for everything.
Commissioner Campy, I know, I will just call on you.
Hi, Ed.
Hi there, everybody. I just wanted to say that first off to Carolyn United Way, thank you for doing this. Any opportunity that those of us that know Rob can have an opportunity, especially for the topic of leadership. He is a true leader. I would count him as a dear friend. All of us have our own Rob Lord stories. I remember when Mark was retiring, I came into the political arena when Mark Robitaille was in charge of the hospital, and we became friends, not as friendly, believe it or not, as I am with Rob, but we were friends. And when he was thinking of retiring, I was concerned that who would fill those very worthy shoes, and we could not have done better. I've known Rob since he's taken over the leadership position. We have had, some of the battles that he mentioned in his comments about coronavirus and masks and things like that were difficult for all of us. And Rob's leadership and his personal and professional advice to me is what gave me the courage and the confidence to take the difficult stands that I took. and the expense that myself and my family paid, I never second guessed my decision because I got that advice from Rob and a lot of his senior staff and local medical professionals. We had to sift through the politics and sift through the nonsense and listen to professionals. Now, maybe, there's a lot of back and forth on, Dr. Fauci and the CDC and the World Health Organization, but I wasn't listening to those folks. I was listening to that man right there who also put his own reputation out on the line. And I watched many people scream and yell and rant and rave at Rob. And so that, from that particular portion of our relationship, I'm very appreciative. But then also, we've all been there. We've had loved ones that ended up in the emergency room or in the hospital, and we were desperate. And there, you wouldn't dare think to contact the president of the hospital. But Rob doesn't think of himself as, like he mentioned, as this high, mighty president of the hospital, someone that is completely out of reach. He came and met my father when my dad was in the hospital. He came and met my mother-in-law when my mother-in-law was in the hospital and treated them like family. And for that, I am super grateful. And could get emotional over it. So I just want to say thank you so much. And I count every day that you're still in your position as a great day for Martin County. And God bless you, my friend.
Thank you, Ed. I too consider you a dear friend. Ed is, and you cannot overstate the courage that it took. I mean, Ed can say what he wants. I get paid to wear the Kevlar, and I work in a hospital, and so and I tried to give good advice, but Ed, I just got to say, I thought that true leadership, true political leadership, is what you showed in that, and I am, in my estimation, there's no question in my mind that when we look back on this in history, you're on the right side of history and everything that you did along the way. And I'm proud to consider you a friend.
Any other comments, questions? Susie, are you going to say something? I see you turned your
I would love to say something. Rob is one of my heroes. He's not just somebody that I consider a friend. He's truly one of my heroes. And while I thank you so much for all you've done for the community, when you talk about inclusion, what you helped us with and what you did for Project Search, which helped over 10 years a number of people with disabilities find and keep jobs, you walk the walk, and we so appreciate what you've done.
Well, that Susie, that first of all, for you to consider me a hero, I'm speechless. That doesn't happen very, very often. Project Search, if you ask me, I talked earlier about what are some of the things I think will be the longest impacts of my career. I'm not sure that Project Search will be one of those impacts, but if you had asked me the things I'm most proud of, Project Search is right at the top of it. I will say this from the very beginning, I was inspired by that because of my daughters and the relationships that they had in school with kids that had the special needs. And early on in that project, in Project Search, some of those kids were in that program. And it became really inspiring to me. And I am so grateful that your organization, Susie, gave me the opportunity to enrich my life through my involvement with Project Search. That's one of the things I'm most proud of, the work that our organization did there and the role that I was able to play with that. So thank you for bringing that up.
Jennifer Doak, I saw that you wanted to say something. She'll be our last comment.
This is actually
a question.
Thanks. This is actually a question, Rob. A lot of what you were able to talk about and accomplish in your values were through your visibility. You did management by walking around. You allowed us to get to know you personally. How do you see that moving forward in our current environment? Because we are definitely in our boxes.
Well, I'm hopeful that we're going to be getting out of those boxes a little bit. I think for social people, and I am a very social person, this pandemic has, I think, had even a more significant emotional impact because we're missing that element from our lives many times. Although for me, I did not as much because I came to work every day and I still was with we were working 7 days a week early on in this pandemic. Nobody got any days off. And but visibility, it's hard to lead people if they don't see you or they don't know you. In fact, that's one of the, I don't do as good a job with that as I would like. I have 3 hospital campuses and 20 outpatient locations, and it's hard to get to them. And I'm constantly running into people who tell me they've worked in the hospital or worked with the organization for years and they've never met me, or they met me only in orientation. And that says I'm not getting out there enough. But to your point, I think that's a great point. Jennifer, that leadership is a big part of that is to be out there, be accessible, and to be visible. At least for me. Now there's other leaders who do it without it, but not my style. That I think also gets back to be true to who you are. To be honest, there's a lot of people that are introverted and aren't comfortable with that, and maybe it would come across as inauthentic. Then I don't know, but if you can, I think it's really important. So thank you for asking that question.
And I would just say I beg to differ on that, because I remember going around the hospital on midnight shifts and morning shifts and standing at doors with you for you to meet everyone in the hospital and running you from shift to shift and not feeding you and getting in trouble. Getting in trouble. You have to feed him. I'm like, oh, I wasn't a very good keeper. But to that point, I think, I speak on behalf of so many people in this community. You are just absolutely amazing. And it has been such a treat to see you, leading our healthcare system from when I was a younger person all the way growing up. You really have gone above and beyond to make yourself accessible to everyone, regardless of who they are or where they come from. And you definitely are the person that walks the walk and talks the talk and does exactly what you say you're going to do. So thank you so much for being willing to come and share all of your tidbits of wisdom with us.
Thank you. Thank you. It's been an honor.
Hey, Rob, this is Carol Vitani. I just want to say that thank you for being an incredible leader and role model. And to be honest with you, there isn't anyone else I would have wanted to go through or experience a global pandemic with. So thank you so much for just being there all the time, talking with me many times throughout this very unusual experience. And I appreciate every moment we've had together, and wish you all the best.
Carol, back at you. You've been a tremendous asset to the community, and it's been an honor to work with you as the leader of public health in our community. But I'll just leave it at that. It's been an incredible honor.
Yeah, it's been an honor for me as well, both to be the health officer currently, and also the honor to work with you. So thank you.
And so with that, we have come to the end of our time together. Thank you so much, Rob, for everything you've done and everything you continue to do. I know we're going to see you fishing and hopefully volunteering with the United Way of Martin County once you retire. Shameless plug, but thank you. And we will be seeing you, I'm sure, very soon. Thank you. Have a good day, everyone. Thank you for joining us.
Thank you all for joining us today.